Warning, all attendees are in listen-only mode.
Hi, good afternoon. Today is Friday, July 30th. I am Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the monthly webinars with Deputy Secretary Bernie Simons. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There's two options to hear the webinar, by computer and by phone. And if you look at the panel interface on your right labeled audio, you can click either computer or phone to switch for the best option. We have one handout for this webinar, and you can download it from the handout section. And we are recording the webinar and posting it on YouTube and the DDA website. Questions can be typed in the chat or question box in the panel, and we will answer those towards the end of the presentation. So now I'd like to introduce Bernie Simons. Good afternoon.
Good afternoon. Can you hear me okay, Donna?
Yes.
Okay, good. Well, again, I want to welcome everybody who's on this webinar. We've been doing these since well over a year, everybody knows, and I want to thank everybody for their participation. We can go to slide 2, please. And so, obviously, today for our agenda, we're going to talk about COVID-19 and the regional updates that we've been doing, but we also have a presentation from what we call our early adopters, the executive director of SEEC, Karen Lee, and Jennifer Mettrick from Penn-Mar. And, you know, you may want to know, well, what's an early adopter? These are agencies that provide supports and services to people that DDA pays. They were paid through PCIS2 in the past. As you know, many of you who are on this webinar do personal supports and did transition into the Medicaid LTSS platform, which DDA has a module of that, and I want to congratulate you. You were very successful in that transition to meet the Federal Cures Act and have it implemented by January 1 of this past year. And so as we move forward, we've talked about going into LTSS, since we are moving into a fee-for-service system. And we have had 5 providers, a minimum, basically say, I want to go forward with this. And you're going to hear today about their experiences from SEEC and Penn-Mar about what they experienced in going in. And let me just say that 100% of the people that they provide supports and services to in their agency are now being billed through LTSS. So they're going to give you an update, and we'll move forward with that. Next slide, please. Good. So again, our highest priority is health and safety, and obviously the well-being of everybody. There was a letter that just went out to everyone, signed by Secretary Schrader and Secretary Beatty. Hopefully you should see that if you're in constant contact, or it's supposed to be going out also through PCIS2 to the providers, that talks about, you know, the engagement with the DD Coalition, with DDA and Medicaid and those both secretaries. And, you know, Secretary Schrader did reach out to the DD Coalition, you know, to engage in their meetings and talk about what does the future look like, especially where the public health emergency from the federal declaration is still on, but the one for the state is not. And then what does that look like for what services do we still need? And, you know, what did we learn? You know, there are a lot of people who said during this public health emergency that they never would have thought that their son or daughter or brother or sister has been as independent as they were. So I think it's been a good opportunity for a lot of people to see more independence. I mean, we know that that's the goal of what we want to move towards, that everybody wants to be either independent or interdependent, right? Since we have to rely on each other as we move forward and coming out of this pandemic and every day in life. You know, we're all about each other and how we do, and how are we supporting each other, and and moving forward and being respectful and listening to each other. And, we can have different points of view, which is okay. That's makes I think the system healthy as we continue to move forward. Next slide, please. So I'll give the regional updates because I want to spend the majority of this webinar with hearing from both of the agencies. And these numbers are reflective as of 3 days ago, July 27th. So in the central region, we have 896 people who are positive. We have had 56 people who have passed away. In the East region, we've got 151 confirmed positive and 6 people who have passed away. South region is 635 and 26 people have passed away. And in the West region is 372 confirmed positive and 17 deaths. When we look at staff, in the South region, 425 staff tested positive with 5 people who passed away. West is 212 positive with 2 deaths. East is 238 positive and 1 person has passed away. And in the Central region, it is 712 people who have tested, staff who have tested positive, and 2 people have passed away. Next slide, please. So obviously we look at this information, and again, this is as of July 27th, and you can see the pie chart on the left represents the number of people who have tested positive, and the participants on the right by region. As you can see, there's been minimal increases. Everybody's done an outstanding job between being vaccinated, and we'll get into those slides in a little bit, but with vaccinations and where we are, but social distancing, etc. I mean, this is like the lowest we've seen, with only 2 in Central and none in the East, and 2 in Southern and 1 in the West region. So obviously we continue to see the lower numbers and stability since the last one, and again, there's only been 5 since the last webinar, and there's been no deaths. So this is really good news, and I want to applaud you for doing such great work and keeping everybody health and safety. Next slide, please. So the chart on the left illustrates that from May 13th to July 27th, 0 people have passed away, and you can see that 2,054 people have tested positive totally, and then on the pie chart you'll see that we've had 105 people who have passed away, and that's also on the line, the bottom line on the graph. So again, I think it's unfortunate that early on we saw a lot of people passing away, whether they be people in supports or staff who contracted the COVID-19. But as people get vaccinated and practice social distancing, I think it's been tremendous that it's the minimal effect, and it's borne out in the data that you're looking at in this webinar. All right, next slide, please. Okay, so this basically shows the number of people who self-direct, and there's been an increase of 1 since our last report who have tested positive, and obviously, so we've got 39 that have tested positive, and we've had 0 people passed away of the, and just so people know, there are 1,595 people who are self-directing their services. So I think it's great to see the growth of self-direction. Just as an aside, when I got here in 2014, there were about 350 people. And, it's one of our basic areas that we want to continue to encourage people to self-direct their services. So we will continue with that. Next slide's vaccination tracking. And obviously you can see of the 222 participants that, we've got a great vaccination rate. We still don't want to stop there, but we've got 78 8%, and with a 22% that haven't. So we need to figure out what we're doing and see if we can encourage more people to become vaccinated. Again, I want to congratulate all the providers and the work you've done with the local health departments and on your own with pharmacies that, having 136 vaccination clinics, I think has been really, really outstanding. And as of today, I am not aware of any future clinics that have been scheduled. So with that, if people are interested, we need to reach out and have those conversations and work collaboratively together. Next slide, please. So again, this is people have been vaccinated, that we have the information from, and you can see with family members, 1374, that's actually an increase of 113 people from the last time we reported out. Administrative staff has been an increase of 56. Direct care staff is an increase of 274. And participants in self-directed services is an increase of 48. So again, I encourage everybody to please get vaccinated, and as we continue to move forward together in this, and hopefully we'll be out of this soon. Everybody sees the news and hears about the variants, etc. So we just continue with our vaccinations and social distancing and masking, etc. So even though masking isn't mandated in many places, it's an individual decision that people need to make. All right, with that, I'm going to stop my portion, and I'm going to introduce Karen Lee, who's coming up next as the Executive Director. And again, thank you, Karen, for being here.
Thanks so much, Bernie. Thanks for having me today. And I'm excited to say, just to follow up on what you said, 96% of SEEC staff are vaccinated, and 98% of the people we support in Maryland are vaccinated. So we've had a really, really good response rate, and really happy to continue to partner with DDA on this. You can go ahead and advance. So let me just start off by saying that SEEC started the use of LTSS back in November for not only personal supports, we had a fairly large personal supports group, but also supported living. We had a number of people. And supported living really tested our knowledge and tested our ability to do the to use LTSS and to have accurate information in there. So just as a starting point for you to know, we really feel like we've been in LTSS since about November, and that's with our partner Jubilee, and we've worked really in an amazing partnerships has formed as a result of working through some of the issues early on in LTSS. You can advance it. So this is just some of that information about supported living. I will tell you, we had a big mess in the beginning that there's a section in the DSAT area. Whoever knew I'd ever get that deep into a funding system this way, but there was a section deep in the area that you actually have to have the accurate addresses, and we didn't know about that piece of LTSS because, of course, we'd never used it. And once we got that, we learned about that address in the DSAT for supported living. And I think for residential programs, you also have to have that accurate address there. It's not until you build that you realize that those aren't correct. So just some really critical things that we learned going into this was, of course, that the PCPs really must be perfect, and not PCIS2 perfect, but LTSS perfect, because the definitions are different. And so they might have correct definitions in PCIS2, but your LTSS definitions and time frames and all of that, they must be perfect. They have to be on time, because if there's no PCP there, you don't get paid. So one of the interesting things that we found out was early on was that DDA is not really in charge of PCIS2, or excuse me, LTSS, let's say. It's really a Medicaid product. And so there was a lot of things that the DDA folks didn't know about because, of course, they hadn't been using it the same way that we did. And working with Val, who was back at DDA then, and with Onesta from the regional office, we ended up getting a hold of the right person at Medicaid. And then Medicaid helped us to work through all of the issues. And they were just really pretty amazing to work with and continue to be. They continue to check in with us on things. But just, you know, our point of reference had always been DDA. And so okay, now you have kind of another person, but it was fine. It worked out well. And they were really responsive once they knew what we were using it for. So you can go advanced. So this was one of the things that we did really early on at SEEC is we recognized that what was happening at DDA was a bit like a game of dominoes, that there were things that that needed to change because of federal laws, as Bernie said, going from prospective payment to fee-for-service and the settings rule. So DDA had a bunch of things they had to change. And as they changed one, they realized they needed to change another, and they needed to change another. And so once we grasped that, all of the changes and why they needed to happen and how they needed to happen, we recognized we needed to mirror that. We also needed to make those same changes. So we'd been working really for about the last 3 years on making some of those changes. You can advance. So some of the really big changes were, of course, that the settings rule and the new definitions, and DDA worked on those definitions to meet that, and also really to implement Bernie's vision of a service system that reflects people's choice and control. And then, of course, the legislature and the issues on the fee-for-service. You can advance that. So, you know, DDA started their changes, and we just went alongside of them. And even though I think we might have been on a PCP work group, but we really did pay attention to what was happening in the state. And so they made the service change definitions, the waiver got rewritten. We started to make our services look like the waiver. They had to change how they were doing the funding because they couldn't fund new services in the way that they were funding old services. And so we started paying attention to those things like quarter hours and daily rates and that kind of thing. So really, as DDA started to make those changes, we went along and made those changes to get us ready for this. He can go forward. So these were some of the things that as DDA was making the changes, we were making the partner changes as well. So the service definition, the planning process, the rate system, the data and billing, the plan approval process, which we'd never really had to pay attention to before, and then the licensure and certification process, which became very different as well. So all of these things were processes that DDA had to change. And they had hundreds of meetings and thousands of hours of work on this. And we just kind of paid attention so that we were making these changes along the way as well, so that we were ready. You can go ahead. Thanks. So we did that. We started with our service definitions. We changed the names of our departments, and we changed the names of our services. We made them look differently. A great example is employment services. Before, there was one employment service. It was just if you work 4 hours a day, you got to check it off. Well, now there's discovery, which is a milestone. There are 3 sets of discovery. We needed to make sure that we had the documentation ready for that and everything. We ended up in a new data system. We're using ICM, which we did very quickly this year when we were asked to become an early adopter. And we did just a ton of training, and that was something that happened good with COVID for us, is it gave us the venue to actually do some of the training to prepare us for this. Next. So getting down to real specifics, one of the things that we did, and we consider ourselves really good partners with DDA, we recognize that our relationship with them is really critical for all of our services. And so when they started talking about making these changes, we raised our hand and said, we are happy to help you pilot in any way. We weren't a part of any of the pilot groups, but we said, if you need us to do anything, we're ready, because we've been getting ready. And so Bernie formed an early adopters group, and I'm really thankful to our partners at JFGH, Jubilee, Abilities Network, and Penn-Mar. It was great to get to know some of them. We hadn't worked a lot with some of them before, and it was really great working relationship, and we shared information. And so when the date was set, okay, here's when we're going to try to do an all-in early adopters group. Our departments at SEEC, we put together launched our own early adopters group here at SEEC. You can go to the next one. So if you can see here, we had captains for each of these areas, and I think that Jennifer's going to share they did some of this as well, because it just kind of makes sense, right? There really is your pre-planning has to be really good in LTSS. Because when you get to that PCP meeting, you've got time frames that you've got to get things into LTSS right, and they need to be correct. And so everything needs to be done in a timely manner, and it needs to be done in coordination with the person receiving supports, as well as their family, their CCS, and any other agency. So it needs to be a much more well-oiled machine. And so each one of these groups at SEEC got together. They had their own committees. They had their own captains, and it was like our domino. This was like our domino effect, right? So we had the pre-planning group, a PCP group, PCP approval, because that's a new piece for us. We never really had this tracking of the PCPs, which is really so incredibly critical. And then the documentation, because we're documenting in ICM, which then just automatically uploads for us. Well, not automatically, somebody's got to push a button. It uploads, and it's a great system to be able to put all of this together. Next. So here's just some of the things that our early adopters groups did. They each had a leader. There were two captains of each group. They brought together stakeholders from DSPs to administrators, and it was a great organizational activity, so people could learn about the change process and learn about new program development. But for each one of these, they created a plan for how they wanted to implement this. So they had a process. They all piloted. They're doing the training, and once the pilot and the training are done, they scale up each of the steps. So that now everybody is doing the pre-planning, and everybody is doing the process of documentation in ICM, and that's how we were able to so smoothly bill into LTSS. Next. The other thing that was so critical is this communication of the plan, because this is really organizational change. I told Bernie that what I see as DDA, they really move the battleship, right? So they're like this huge organization that supports lots of people, and all of the changes they did was like moving this great big battleship. We're of course not that big. We're a little bit smaller, but it still is, you have to work in tandem together with all levels of the organization, because now direct support staff have to understand what service definitions are. So people have to know what service definitions are. So we had lots and lots of communication of each of the departments had their plan, or each of the early adopters groups communicated how they were going to implement their plan, how they were going to implement their new activity. Next, please. So this is a little bit about what they did. The pre-planning people, they created an entire process for pre-planning in ICM, as well as our pre-planning process, to make sure that it fit with DDA. Same thing with the plan, with the meetings. What documents does DDA now need? Can they just be automatically uploaded? How do we make things more automatic so that we can make this much smoother? We onboarded ICM incredibly fast. We had another system, and we decided not to have that system talk to LTSS. It was not a great system to begin with, and ICM had already created that link. And so we decided to go into ICM, and we did it very quickly. We started, I think, March 1st with them, and we were all ready to go with our billing on July 1st with them. So great partnerships. So we can go to the next one. I wanted to just share some of the tools. So when people go to a PCP meeting, they've got to understand things like how many units, what a unit is, everything. So this is a document we created. Steve Blanks here at SEEC created. If you can see, these are our services. So in the middle, we say live, work, and thrive as our theme. On the outside of the circle is all of the different kinds of services, the service definitions. And outside of that, in the boxes, are the different, the amounts of money that everything is. And I wanted you to see some of the tools that we've created to make this a smoother process. Next page. So we created this LTSS cheat sheet, and I think you'll hear from Jennifer, they also created one as well, because that LTSS cheat sheet is just, you've got to know everything has to be right, or else the dollar amount comes out wrong. And you, by the way, you can correct it. So if you put something into LTSS and you bill for it one day and you get the bill back and you're like, this is not what the rate should have been, and then it's because there was a mistake in the PCP, you actually can go back and update the PCP. It has to go through the whole process again. You can't just make one change. It has to go through the whole process. And once it gets approved, the billing automatically happens. You don't actually have to do anything. It'll correct itself. And we've experienced that a number of times. So this is what our LTSS team that gets together once a week. They approve all the plans. In the process, they make sure that all the pre-planning is ready for the PCPs. This is their cheat sheet that they use. Check, check, check to make sure that everything is in line so that we don't have to go through the system again. Next slide. This was a tool we use to talk to families and people we support about the difference between personal supports and supported living, because a lot of people, they were correctly in personal supports under PCIS 2 definitions, but they were not correctly in personal supports under LTSS. The definitions are different, and they needed to switch over to supported living. Now, their services didn't change at all for us, but we wanted families to understand this. This is part of that communication, because the actual definitions are different, and people just have to know, why is it that we're changing this? People just wanted to know. Next one. And this is just one of the things that our groups did. This was the rules for our PCP team. So here's what the frontline supervisors have to do. Here's what the DSPs have to do. Just so that this is one of the tools that was created for our training, so that everybody kind of understood what their roles were. And that just those last 4 or 5 things I had in there. I wanted you to see that we created all sorts of tools to make this a much smoother process. And I think that's it. Is there another one, Donna, or is it on to, oh, okay, here's where my captain, I just wanted to give them a shout out. They have been absolutely incredible. So it's been all sorts of people in the organization that were captains of this process, and they have done an absolutely amazing job. So kudos to them and all of the teamwork for, we have liftoff, it's doing really great. So, and I think that's it. So I'm anxious to hear what Jennifer has to say, because we work together, but we both had different strategies. So it's been great to work closely with both the other ELT or the other early adopters, as well as DDA on this process. Everybody's been working really hard together. So thank you.
Thank you, Karen, so much for your presentation. And just a reminder to all participants that you can write questions in the question box, and we will be asking Karen and Jennifer questions at the end of the presentations. But thank you again, Karen, for that wonderful presentation. So now I will be introducing Jennifer Mettrick, Chief Strategic Officer from Penn-Mar Services. Jennifer, take it away.
All right. Can you hear me, Karen? All right. So I'm Jennifer Mettrick, and I am from Penn-Mar Human Services. You can go to the first slide. So we're going to talk to you a little bit about our implementation. Many of the same strategies that Karen just outlined for all of you, we also put in place. The good news is that we are 30 days into our implementation. So we started full implementation July 1st, and we're successfully billing in the system, and we are close to the revenue projections that we had put forth based on the services we're providing. Still working through a few challenges, but the partnership has been really amazing to work through all of our challenges as we've walked through this process. So you can go to the next slide. So I wanted to give you a little sense of our scope of implementation as well. So as many of you know, we support people across both Maryland and Pennsylvania, about 600 people. 350 of those are located in 2 regions. We worked with the central region and the western regions. And so we're providing services across a multitude of different service types, from residential to day and employment services, personal support, respite, shared living, and a few of the new services like peer mentoring. We also had an additional level of complexity throughout our implementation. We had a recent merger with Change Inc. from Carroll County in the last 18 months to 2 years. So that added a few extra steps that we had to take around our e-prep and our licensing, and a few extra hurdles that ended up causing us as part of this. And then we also are coming into this because our full focus has been on preparing for LTSS. We haven't merged our 2 billing and case management systems. The 2 organizations came with 2 different systems. So we actually had to work with 2 different vendor partners throughout this process. You can go to the next one. So boiled down into all the preparation steps that we had to take, similar to what Karen shared as well, we started with an internal task force a little over a year ago. We weren't sure at that time when or if we were going to be able to come in as early adopters, but we knew we needed to do quite a bit of preparation to be ready for LTSS implementation. And so we pulled that key task force together. Prior to that, just as Karen mentioned, we really were going through transformational efforts across our organization to align with the changes that were happening within the system, within the new home and community-based settings rule, all of the new services that DDA was developing as part of the waivers. And so again, paying attention to all of those changes. We've been doing that probably for the last 2 or 3 years as well, and aligning our structures, the way we were providing services. We started that journey quite a few years ago. But when we actually got down to the technical aspects of LTSS implementation, that started about a year ago. That internal task force really pulled together all of the different units across Penn-Mar, from our services team, which we call operations, to our finance team, to our IT team. And that was really critical that everybody was on the same page. We were meeting on a monthly basis. And then we also broke in to different groups to focus on the key areas of preparation. Same kinds of groups, put a lot of time and attention around the PCP process, making sure we had all of those details in place, working with our vendor partners to make sure that we were aligning with all of the changes that were happening with the PCP process and the new requirements in LTSS. We also had a group focused on all of our billing and reconciliation workflows and the changes that would need to happen with that, understanding those changes, what was going to be different from our PCIS2 system to the fee-for-service LTSS. So all of those things came into place. We participated heavily in both the state and regional early adopter teams. This was absolutely critical, and I'll talk a little bit about our successes. Those regional early adopter teams were pretty amazing for us and really were part of why we were successful going into July. We did quite a bit around e-prep and licensing, and we actually had done that as 2 separate organizations, and then we merged. We had to re-go through those processes, and that's where all the details are so important as you're transitioning into this new system, all the preparation of your sites, your specific MA numbers, all of those things need to be checked, rechecked, and double checked, because we found some discrepancies there throughout our implementation that if we would have done that up front, we could have avoided some of those pain points. We did a lot of training on the LTSS system, both the trainings that were provided through DDA and then also created internal trainings because there were new processes associated with time capture and billing and documentation. There were different groups within the agency that needed to be trained on those different processes. And then the system reviews. This is everything from the PCP reviews, and as Karen mentioned, PCPs have to be perfect and perfect in a new way. The level of detail that needs to go into the planning process for PCPs is critical and really needs to make sure that it has the whole picture, all of the services, they're in conjunction with how you're going to be able to provide them, and all the details down to the specific units and what days they're going to be provided on. All of that needs to be communicated up front, agreed to, and then put into the PCP accurately, because that will then create your ability to provide that service and then bill and get paid for that service. So we also developed a specific Penn-Mar services guide that we trained our team on. And so we took the billing services and authorization guide that's on the DDA website that's been frequently updated. I think the last one was in April. And so we took that and we created how we were going to provide each and every service within those guidelines. Because you'll see with LTSS services, there is more flexibility. There is the ability to make services much more individualized for each and every person. And we wanted to make sure we were putting the right parameters on how we as an agency can provide those services. Because there's no more of the just 9 to 3 day programs. You really have flexibility to provide lots of different kinds of supports all throughout the day, evening, and weekends. And we wanted to make sure that we had a process and a structure in place in which to do that well, and we could meet the needs of the people we were serving. So quite a bit went into that. And then, as I was saying, we did a lot of teaming around the PCP development. So we've never teamed like this before. This was a whole new level of developing that collaboration with the people we support, families, and the CCSs, and really learning some of those services and the nuances together. We also had to develop all new workflows around time capture, documentation, and billing, and of course, testing. So when you're working with case management and billing systems, really making sure those systems align perfectly with LTSS and are helping you make that easy transition from PCIS to LTSS is really critically important. And so we put a lot of time and attention in that. So next slide. All right, so here's some of our successes. You can move on. We had 3 major successes, I would say, in terms of why we were successful going in July 1st. One of those was collaboration. We had amazing collaboration at the regional level, and specifically, both of the regional DDA offices created teams where we had CCS organizations, all of the regional office staff, the provider agencies that were early adopters, and we worked through all the issues. We worked through general issues, specific person issues. We really learned quite a bit about the intricacies of LTSS and the perfection that's needed, because some of this is just trial by error, getting plans approved, making sure everything was in alignment. They really just went the extra mile, making sure all of our services were in the system correctly. We had everything for licensing. because again, we had some challenges along the way. The PCP planning process, taking that to the new level really helped us do the PCP right and make sure that we were coming alongside somebody and their family to provide the right services in the right way. And so that was that kind of collaboration really helped to enhance the quality and certainly be successful in the implementation. Our internal task force was critical. If we hadn't had our regular meetings, our groups that were attending to each piece, and then pulling it all together on a regular basis so that we were all on the same page, it would have been difficult if we hadn't have put the time and energy around that. And specific positions. So we had the ability to hire for a couple of new dedicated positions. One of them was our applications manager as part of our IT team. She was the glue with everything. So she helped our finance team prepare and our services, our ops team, and making sure to partner with the LTSS help desk, with our vendor partners to make sure our systems were working accurately. Without her keeping all of that communication, every challenge, every issue, she was tracking that, documenting it, and making sure we had resolution on it. And she continues to do that now. So having some of those key positions that are attending to the detail was absolutely critical. And then of course our vendor partners, we had some great success with the API uploads, the automatic upload to LTSS, and just being prepared in general because of our case management partners. So next. One of the things, and I could probably do a 90-minute webinar just on the shared understanding and the growth that we've had as part of these partnerships, really understanding the new services. So as Karen alluded to, there's a lot of transformative change that's happening. This isn't just transforming to a new billing system. This is really the opportunity to transform how we provide services, how we utilize them, to really more effectively support people. And a lot of the services, particularly the employment services, are brand new. It's a different way of looking at how we provided those supports in the past. So there's a lot of learning that's involved in that. And so having that time and meeting the intensity of the PCP process to be so specific and accurate, that really helped us dig into those definitions. We had regional DDA representatives that were helping us interpret all of the new guidance, because there were a lot of different interpretations that were flying around about how to be able to provide one service versus another, and the parameters that went around that. So having everybody at the table, particularly at those regional team meetings, really helped us get clear on how to move forward and what services really meant and how we could utilize them. So that was a huge takeaway for us. And then finally, go to the next one. Our case management, we had particular success with one of our case management systems through Twinsys, where they were able to set us up in first using PCIS to had our teams acclimated to how to document, do time in and time out, even though we were providing day services in day billable units at that time, being prepared to switch easily over to 15-minute increments was a very seamless transition for us. So because we were able to train our team in advance, we started about 18 months ago, where we're designing all of the services. So we had the PCIS services, but we were also designing LTSS services in that system in parallel for that easy transition. We were getting our teams used to new ways of documenting, making sure they were paying far more attention to the people's goals and how to document on those goals. Again, listening to all the things that were coming out through DDA and trying to align with those things early and practice those in a system was very helpful. And then we were able to pull all of that as soon as they switched over to LTSS services. Our DSPs really were documenting everything in the same exact way. So they were new services. There was less training on the DSP end, more training for our managers and coordinators on how to utilize the new LTSS services, but less so for DSPs. We were able to pull all that information together in a claims processing system that completely aligned with LTSS. So the API upload worked on day one, which was excellent. Then we're able, so even though the system, the API is not bi-directional, we were able to pull reports out of LTSS that go back into that financial database to give us real-time information on where claims were at. How many services did we bill? How many units? Where are they in the process? Have they been paid? So we're able to see that on a regular basis. And having that look into the whole process is really important as you're transitioning from a prospective payment system to a fee for service. There's much greater detail. And having backups also to be able to do manual claim submission if needed, because there's always outages and things of that nature, making sure that you have both functionality ready and in place. Go to the next one. So we did have a few challenges. I do want to say that the challenges we did face, almost all of them have been addressed or are being addressed as we speak, or there's plans to address them. And so we're very confident that as we come into the next couple of months, we're really going to get to that 100% maximizing of the system that we thought we were going to, and be able to align our revenue projections to what's in actuality what we're being paid for. So you can go to the next one. So we kind of two different areas of challenges. One was around provider setup. So this is where that attention to detail is critical, and checking all aspects of the information that's in LTSS. Not everything is going to come over perfectly from the PCI-2 system and ePrep and other sources of information. So there are reasons that, as Karen said, even down to the address on the DSAT, these are things that need to be highly paid attention to as you're going through the processes to make sure it's accurate. Making sure that you're even checking, saying, your group home configurations. We had quite a few people that had the wrong addresses associated with them, so therefore sites looked like 3-person group homes versus 4-person group homes. And of course, that is going to affect your billable rates, then will affect the revenue that that's coming in. So all of those things need to be accurate and correct in the system. Just little things like making sure provider locations are turned on in the system and activated with the right effective date. Another place, and I think Karen also mentioned this, is around PCP effective dates. So I can't say enough, having people in your organization with attention to detail around the whole PCP process is critical. Having checklists, having the ability to make sure exactly what you need in that PCP, and looking for things. So because if your PCP effective dates are off and they're not matching, there could be a gap in services, and you won't either be able to provide that service, or you're not going to get paid to provide that service if you do. And so that's really critical as part of the process. And even down to validating units that are entered in. So one of the things, and you can go to the next slide, that we found was that there's some LTSS system issues. So there's different views. There are CCSs have a slightly different view in LTSS as the regional offices, as providers. And so one of those places is around the units that are going into LTSS. And so we see as providers a summary, a monthly summary of those units, but there's very specific day-to-day units that are put in through the CCS. And so we've worked on a workaround. We share screens with our CCSs now in the PCP prep process to make sure we know exactly how they're putting those units in so they align with how we're providing service, because we also want to make sure we're have the opportunity to provide as flexible of services as possible for people. And so if they want to change their personal supports from a Friday to a Thursday, we want to make sure that we flexibility in the system. And if it's entered right, you can. If it's entered wrong, you can't. And so that's some of those things are things that we learned, because that information then has to go into, if you have database management systems, into it accurate, so you're tracking that. And then we're working on a few final adjustments needed in LTSS around some of the meaningful day services and being able to bill those. They have the same W codes, many of them. So for example, small group, large group, and making sure that we can bill that service in the same day. So just the system not always linked perfectly with how we're intending the services. So those little nuances are being worked through. And then finally, just a few lessons learned, which I feel like I've touched on. You go to the next one and the next. So you can never start too early. Preparing for LTSS is certainly a journey. There is a lot of work to it. You need dedicated people that are paying attention to it. And certainly if you haven't started already, you can start now. And everybody has started in terms of e-prep and licensing, but the level of detail to look into whether that's accurately being represented in the system is really important. Having a really good understanding of the new services is critical to success. It's going to help have more detailed conversations with your CCS as part of the PCP process, and making sure that you're really being able to tap into all the flexibility and opportunities of those new services for the people you support. As I mentioned, having dedicated folks in your team responsible for the different areas of implementation, and having those great partners in terms of a case management and billing system. It really is going to make it much more efficient and effective if you have a system that is fully aligned with LTSS. It's going to help you make that transition from PCIS 2 to LTSS seamless. Partnering with your regional DBA team, especially the provider relations folks, huge shout out to them. They were really critical for us working through all the little hiccups that came up along the way, and it just was imperative to our success. And then just joining local collaboratives that are talking about the new services, where you have DDA representation and CCS organizations, providers and advocates together to really talk about how we can really maximize this new system and raise the bar on quality for the people we support. So that's all we have. We certainly are available for questions even after the webinar. There's a lot of detailed information we could share and tools such as Karen showed as well. So we're happy to help in folks' transitions in any way we can. So thank you.
Thank you so much, Jennifer. That was amazing. Again, thank you to Karen and Jennifer for presenting today. We will be able to take a few questions, but just a reminder that we are now doing monthly webinars. This slide has the link that you can share with your colleagues, families, and participants. And after registering, you will receive a confirmation email containing the information about joining the webinar. So I'm going to introduce Robert White, our Director of Fiscal and Operations, who will read some of the questions that we have for the last few minutes for our presenters. So thank you so much.
Hello, thank you, and good afternoon, everyone. So we have a question for our two presenters, Karen and Jennifer. can you talk about what you're seeing regarding the rates in LTSS versus what you've seen in PCIS 2?
This is Karen, and I mean, the rates that are on the DDA website that say LTSS rates are exactly the rates that are in LTSS right now. And I actually never knew how to use PCIS2, so I never really saw the rates there, but I would definitely say the rates are higher in LTSS. They are different services. You have to remember that. These are not one for one the same service. There may be some that are, but what we're providing is a bit different. So I would say, you know, we're doing the 15-minute units for things. That's different than when you get a day unit. But if you compare apples to apples, which we're finding services don't really go that way. You know, you might be supporting somebody who has to go to the doctor in LTSS, and so you only can bill for the hours that they're there. Let's say they're there for 4 hours and 15 minutes. That's all you bill for, or 2 hours and 15 minutes. That's all you bill for. Whereas in the other system, in the PCIS2 system, you bill for a day. So there's less payment for things that don't happen. It's like when everybody made this switch over to personal supports from CSLA to personal supports when we went to the 15-minute increment. There was a lot higher absentee rate than we thought when we were billing for a month of service at a time, 1 unit, versus a 15-minute unit. So I think, you know, we don't know yet how it will even out in terms of when you're down to the 15-minute unit, how it'll turns out. But if you look at apples to apples and you say 4 hours to 4 hours or 6 hours to 6 hours, LTSS rates, which are the rates that are published in or that are on the DDA website, are higher.
Great, thank you, Karen, for that. One more question for SEEC and/or Penn-Mar. Did finance or programmatic staff complete the DSAT? And then an add-on question to that is, did finance personnel review and approve within LTSS?
So I'll answer for Penn-Mar. It was actually our services team, because they're closest to what people need and are saying that they would want in terms of service. So they were trained on the DSAT. They approved those services. Certainly, we partner with our finance team on a regular basis around that, but it is our services team that's doing that process.
And I'll say for SEEC, as a part, this is part of that monstrous process that we've just created. The DSAT is created in the pre-planning process, and then it goes to the CCS at the meeting, and then it gets followed through the process. And after it has been approved, it is then sent over to finance. So finance, I will tell you, one of the really important things is that LTSS at this point does not have the same opportunity for budgeting to just pull down the rates. And so it was a monster to create this year's budget, because we actually had to go into every individual person's piece of information and their DSAT on the LTSS and pull out that number. You can download the entire agency, but we did ask the ISAS people if they could create a report that would pull down the rates for us, for everybody, in a nice report. And they said they are going to work on that. It's so easy in PCIS2. You push a button and you say, everybody who's getting services at SEEC, here's how much they're worth, you know, how much they cost, and or what their rates are. It's much more laborious. So keeping track of those changes in DSAT as they get approved by the regional office after the final step, it will save you a lot of time in the end.
Great, thank you. And one final question. By the way, we will ensure that we answer all of these questions and get them back out to you. But one final question, and this is for SEEC. will you share the prep questions that your team used?
The LTSS, the LTSS process, is that, I'm wondering if that's the, well, they're all in the PowerPoint. And so they can have them, or they can email me at klee@seekonline.org. I am going to vacation this afternoon, and I'm not looking at my emails next week, so they'll have to wait a week. But absolutely, we'll share anything, as Jennifer said, and work with anybody who's got questions or needs help. And again, I think you know, that's been one of the really great collaborations that's happened through this process. But you can have, you know, absolutely, we'll share information.
Great, thank you, Karen. And again, we'll get these questions answered and get them out to you, and include hyperlinks to any material that was requested. So with that said, I'm going to turn it back over to you, Kathleen.
All right, thank you so much, everyone, for participating in our Deputy Secretary updated webinar. We really hope you enjoyed the presentations from the early adopters. And again, stay healthy and safe. And thank you so much for supporting the Developmental Disabilities Administration. Thank you for your time.